we a lot of times might be the only healthcare provider that patient sees. And I think we have to kind of change our mindset as dental hygienists and dental providers to really think of ourselves as we should be thought of as part of the healthcare team. We're healthcare providers. When we're able to get into child finds and WIC clinics and different places, that's where I think we're really going to make the difference. I think that's where our changes are going to come from. And I grew up in an area of low access to care. I was that person, and so quality is so important to me, that we're really taking care, we're educating, we're doing the best job we could possibly do. And I think a lot of times when we do think of public health, we do think of substandard, and that was just something I would never want to put my name on. And I love each of our patients so much that I just want to make sure that we do the best for them.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 344. My name is Andrew, and thank you so much for being with us today. Today, we have a great show for you featuring Crystal Spring. We did record this outside of the exhibit hall at RDH under one roof, so you can expect a little bit of background noise. But it's always a good time speaking with her, so we're really glad that we got it in. She's incredibly passionate about taking care of people, and I think that you can really feel that come through in this episode. And one of the things I really appreciate about her is how she's always working at getting things improved in the places that she is, if it's not meeting the needs of the people that she's serving. And I know that sounds kind of vague, but you will hear some of the things that she's helped evolve a little bit later on this episode. And next week, I'm so happy to bring you another episode with guest co-host Michelle Hudson featuring Dr. Doug Thompson. It was another fascinating show, so be sure to hit that subscribe button so you don't miss anything. And I want to take a quick second, speaking of Michelle Hudson, and say a huge congratulations. She just got engaged this past weekend to the love of her life, Neil, and we couldn't be happier for them both. Beyond everything that she's ever done for us here at the podcast, she has just meant a great deal to me and my family personally. Michelle's the kind of person that she just lifts everyone around her, and she really deserves that really great partner that she has found in Neil. And Neil, who you probably don't know, it really is sickeningly a perfect match. He's incredibly smart. He's loving. He's down to earth. One of the things I think is really rare to find in life is he knows who he is. Like, he knows what his role is in life. He knows where he's headed. And I think it's a perfect match. So to the both of you, if you're listening, I'm so happy that you found each other. Congratulations. Wishing you guys the best of luck, of course. We have another review. This one is actually from a regular on the show. And so it kind of feels a little bit weird reading the review, but hey, it's still a review, so we'll take it. It's from July 29th, entitled "Love, Love, Love This Podcast!" 5 stars from Steph.PosturePros. I know, really cryptic, right? She says, "I love ATOTH. They have such relevant topics and guests to help us navigate dentistry and all the changes that are happening. The hosts are down to earth and make the content relatable." So I'm sure, Steph, that you're talking about yourself, about when you're co-hosting the show and you make it relatable, and I appreciate that about you. Can't wait to have you back on as a co-host in the future. I was going to tell you all a story about how I tried to book Jason Dorsey on the show. He was going to talk about generational gaps in the workplace. I'm going to save that story for another time, just so that this intro doesn't get too long, because I got shut down in spectacular fashion, and it's a funny thing. I'm not taking it personal that he couldn't make it to the show. But with that, have a great week, everyone, and enjoy this episode with Crystal Spring and guest co-host Erika Flateau.
A tale of two hygienists.
Hey friends, quick pause in the show to remind you about the CE offered for several of our episodes. All you have to do is click into the show notes and follow the link to the CE Zoom website. Answer a few of those questions about the episode correctly, and you'll be rewarded the appropriate amount of CEUs. This wouldn't be possible without a partnership with our friends at TempStars. TempStars is more than just a temp and a placement service. They are clinician-led and education-focused and and strive to perfectly match individuals and dental offices. Learn more about tempstars.com or go back and listen to some of their tip episodes. They are absolutely worth the listen. And now, back to the show.
So,
Medical dental integration.
So I think that's a lot of what the nonprofit, what we're doing is. I'd like to talk about how a lot of times you might be someone's only provider that they see that year. You think they're just coming in for a dental visit or you're just going to be screening them. You might be the only person that looks at that patient that year. And
okay, let's talk about that.
We really have to up our standard of care. There's things people aren't doing. I like to talk about that.
Okay, well, let's keep
What
going.
do you think about that?
Let's keep talking. We're already recording, so let's
do
this.
Already recording.
Yeah.
Okay.
So, I mean, okay, so let's start from the very, very beginning. So why is this dental and medical integration an important part of what you're doing?
So I live in a very rural state. I live in Montana, and so HIPSA areas, so areas where there's health provider shortage areas, and those are throughout the country, but ours are pretty significant. And when we see patients, when they come into one of our either a school-based clinic, the nursing facility, we do community-based clinics, we a lot of times might be the only healthcare provider that patient sees. And I think we have to kind of change our mindset as dental hygienists and dental providers to really think of ourselves as we should be thought of as part of the healthcare team. We're healthcare providers.
Do you feel like in your area that we're not considered that?
I think just depending on sometimes when, we look at our dental hygiene standard of care, and sometimes we skip even the basic stuff. We're not looking at their blood pressure. We're not doing a thorough review of their medical history. We're not asking them questions. We might look at it, but we're not engaging the patient and talking to them and asking them questions. We're not asking them what they're eating. We're just telling them, don't eat sugar.
Yeah.
Right.
Don't drink pop. I mean, but there's so much more that goes into it. The nonprofit that I work with, we actually work with nursing students, and at a lot of our clinics we'll have all these different stations set up, so we'll actually be able to see a patient's A1C levels when they come through, which is really, really helpful. It would be amazing if we could do salivary diagnostics, all kinds of things, but even just being able to have this information like their A1C levels, making sure to actually do an oral cancer screening, that you're actually doing it, not just checking the box that you did it. And I'm not picking on hygienists as a whole, but we have a lot to do. And I think it's just really important that we're actually doing it.
Do you guys have a particular workflow? Like they go see medical first and then they go through dental, or they go through dental and then they go through medical?
So not all of our clinics are like that. So when we're in a regular school-based clinic, we work with the school nurses. We do everything that we can, but we're not able to have A1C levels on the kids yet. But that is something we do, interview them, find out what they're eating and those kind of things. But when we do our big group clinics with Montana State University Nursing Department, they'll do heights and weights and A1Cs. They're going to take their blood pressure for us. All kinds of different screenings, and then they'll come back to dental last. And the really cool thing that we are doing also is then at that time, the nursing students will be able to use our intraoral cameras to actually look around. And I developed a curriculum with MSU where I'm teaching these nursing students the J1s first, and we're also going to be teaching the nurse practitioner students for the first time how to use these cameras and how to implement them into their practice, so they know what to look for. So if you've ever used a pen light, you can't see anything. And these intraoral cameras have been amazing for them, just being able to record things they see, questions that they have. And the part that I thought was really funny when we first started doing this is that I was like, it's going to be really hard, because in dental hygiene school, you're like, I don't know where they're going to fulcrum. I don't know where they're going to get a good pictures. And their pictures they're really good. I'm impressed. I'm like, okay, I guess anyone can do this. So
may I ask a quick question?
Yeah.
So in urban or rural settings, a lot of times any patient sees a hygienist more than they see a medical doctor. I mean, we know that definitely in private practice. But so when you're in a situation like this, the question is always going to be time. Do you have enough time for all this? How much time are you given with these patients?
So when we're in school-based, we have as
Yeah.
much time as we need.
Yeah.
You know, we look at a lot of different things of how we're going to treat our patient and what we're going to do that day. If it's a patient who doesn't have a dentist of record, if we've talked to the parent and we know that they haven't been to a dentist ever, like we start looking at things a little bit different. We also look at school attendance rates. A lot of times when you have someone in your chair, that might be your one shot to do as much as you can to help them. All of that can be really humbling. You know, you want to see as many patients as you can. Obviously, you want to be as efficient as you can, but sometimes you just have to take more time.
Right. And that's hygienists, I think their hearts are always in the right place, but they're like, when we're talking about blood pressures, we're talking about oral cancer screenings, it's a time factor sometimes. And that's where it sounds like there's the ability to really be thorough in your setting.
Yeah. And I believe we can do it in all settings, though, if we work with as a team, correct? If we're working with, you know, the assistants in the front desk, and just, I think it's a matter of making sure everyone on the team is educated in what we need to be doing and what's expected. And I know that we all can't do everything, but it is so important when we are their only healthcare provider, whether you want to be or not.
Before you were helping with the nursing students, did they have a protocol for going to the process of care for oral, assessments?
So no, it was 4 years ago. I was working on an oral health project, just talking with one of my friends she's a professor at the nursing school, and she got an oral health grant and brought us in. And as far as the nursing students weren't out there, they do their head and neck exam is what it was called. So they would take a look in their mouths, but now they're seeing so much clearer.
Now, when they see these things, is it kind of like what we do for like oral path, where we're like, that's abnormal, refer out? Is that basically what they're trying to do?
So that would be the goal.
Okay.
So they're always with us. We do the referring out, but it's getting them used to it. It's getting them in a position. So whatever software they're using, when they are out in private practice someday or whatever setting they're in. Right. But just letting them know about a tool that is pretty inexpensive also, which is going to take a lot of burden off of them when they can't diagnose or they don't know what something is.
Kind of a simple question maybe, but like, how do you get the software integration for an intraoral camera to talk medical and dental? Like, what software do you guys use for that?
So we use a couple different softwares, and we use mouthwatch cameras, so we're definitely into their software. And then we can also upload it onto, we use Tab 32 also for our software as far as how we chart. And so we can download it into that really, really easy. Also, like all hospitals, everybody has different softwares. So a lot of these cameras are really compatible.
Yeah. Cool. Well, which is really good. I think it's always like the scare though. Like every time we bring in new technology, it's like, oh, it's going to work with our system. Oh, yet another thing we're going to plug into our system.
So teaching this, it was so easy for the students. I felt maybe because I'm older than a student, so I was like, oh, they're going to have trouble with this. And then I'm there troubleshooting, and there's no troubleshooting to do. So I'm like, oh, okay. Well,
just figure it out.
Yeah. I mean, it is pretty amazing how these students with all of this technology, they're just really, really good at it.
Yeah. Do they get excited about doing that particular thing, or is it like what you were saying earlier, like one more thing in our limited time that we have with the patient?
So I'm going to brag a little bit, but the nursing students that work with our program, I get texts and phone calls from people all the time just saying like, oh, I ran into so-and-so and she just could not believe what they were able to do with your program and like how excited they were to be a part of it because they understand, everyone understands now that your oral health is part of your overall health. And it's pretty basic anymore and they're excited to have some things that they can do.
Sure. Question. Is there any concern with, we always talk about, okay, dentists are frustrated because we're trying to expand our scope of practice as hygienists. Hygienists get frustrated because the assistants are trying to expand their scope of practice. Is there any pushback on, okay, not only are we having assistants come into hygiene, but now there's a potential that we're opening a door for a pathway for nursing to take over hygiene as well?
I don't see that. Nurses are so busy with so many other things. Like, I don't see that. I think that what it's going to do for dental is they're going to actually be referring. We were talking about it earlier today. So often people can have something that's wrong with a tooth. They can have a sore on their tongue, but they have way bigger problems going on in their life. Mm-hmm. Even someone whose child has been referred over and over again, if that child's not in pain, often they won't get the treatment because let's be honest, people have bigger problems than a cavity.
Mm-hmm. What are the barriers? Why aren't we seeing this medical dental integration like closer? Because not that this is the first time I've heard of it, but this is the first time I've heard it working really well.
So I think part of it is, so we're part of some pretty large oral health grants, and that makes it doable. We take them on location where they can actually see things. They're not just in a classroom looking at each other. They're able to use these cameras to work.
Right.
And I think that helps a lot. I think some of the barriers might be how their education program was set up for a while. Like, they didn't have enough oral health in there. And now I think it's going on all around the country. I know what they're doing at MSU is amazing, but I think it's going on in a lot more places than that.
Yeah. So, my assumption is, we were just speaking last night to one of the educators, and they were saying about, this isn't really talked about enough. Public health isn't talked about enough. They have their one class, usually, in a 2-year course or program, that they don't talk about it nearly enough. So what needs to change, do you think, in our in our education system to get more people involved?
I think obviously I think all schools are required to have a certain amount of public health. I think working with a program like ours where they can actually see it, it's not just something a school is doing, like we're going to go in and do this 1 week of public health. They're actually joining a public health team. They're able to see what we do. Our team strives to see each patient at least 3 times a year. So if you look at mobile that way too, it's really important that you have consistency. Nobody wants people coming in, seeing people once and never seeing them again.
Right.
Our goal is to change their oral health, to help them find a dental home if possible. And sometimes it's just not possible. Something like that works better, when they can actually see this is the real deal. We don't just come in there with a table and say we're going to brush your teeth and call it a toothbrush prophy. Our clinics are amazing. I'd love you to come see someday. I'm super, super proud of them. I think that every kickback we've ever gotten from anyone saying, mobile or public health is not quality health is just made me especially just be, I'm going to make it better. And sometimes I would say 99% of the time, I believe that the way we're doing mobile is better than any services you'd get in an office. We are so thorough. The only thing we can't do a lot of times is, get them seen by the dentist. And that's where the referrals are really, really important. And that's a really big, heavy part of our job.
How do you handle the diagnosing part then?
So we use teledentistry. A lot of times we'll have a dentist with us, but we still take intraoral images and x-rays if needed. So we do all of it through teledentistry.
Wow. Awesome. Access to care. So
yeah,
cool.
It's amazing. And so it's asynchronous, but our dentists are pretty quick at getting back to us. And it's a lot of fun.
How much experience do you have with teledentistry?
None.
Not
I
very
just
much.
know, but I was thinking back on when I was in a volunteer position working with people where it was like you get a half hour, do what you can do, and these people stand in line all night long. And you wonder if you're doing more harm than good, and it does make you think, is this what public health is? Is this what? Yeah. And so I'm just fascinated hearing how you're able to take the time and be comprehensive with patients and then see them back 3 times a year. That's incredible.
Yeah, and so we actually joined up with another part of Montana State University. It's called Proyecto Salud. I probably said that wrong, but they're essentially migrant clinics, and we're doing them once a month. And they're the kind of clinics that are a line out the door, but what's really exciting is we're seeing them again.
Wonderful.
Like, they come back the next time. They're still in line, but we're seeing them again. And MSU has worked on some grant funding to actually help them get into dental offices. A lot of them don't have insurance or any way of any public assistance or anything like that. So that's kind of beautiful in its own.
Yeah.
watching that like every month, and then you actually knew the person when they came back. And so it's been really, really exciting.
Right.
It's interesting that you work with so many different, I would say like groups of population, but it's centralized to a certain like demographic. But it's a big, so for instance, like down here in Florida, you know, we'll see people from the whole spectrum, from, you know, East Asia all the way, you know, through the Caribbean, all that, like a very, very wide scope. But when I'm hearing you talk, and I know the different, you know, places that you visit, it seems like you're targeting a group of people that are underserved. Are you seeing specific trends in different groups? Like, are there studies that are going on to help get their health even that much better that wouldn't serve a different group differently?
So I grew up on the Fort Pitt Indian Reservation, and access to care on the reservation that I grew up on, the demographic is the community as a whole. So there's people who don't have access to Indian Health Service that live there. It's still like 300 miles to Billings, which is where you're going to find some of your best pediatric clinics. There is some groups. There's a clinic that we work with all the time that actually has a dentist up there a couple times a month, or it might even be more than that. And there are regular general dentists also. But some of these areas, it's just a lot harder for them to get care. We do have some research that we could talk about. It's just, I want to be careful.
No, it's okay. And it's fine to be careful.
Yeah.
I think this is, you know, international audience. It's really hard to, I think, pinpoint and answer that question. It was a tough question. It's just, you know, when we are seeing it, and this is all anecdotal, right? We don't have the research behind it, but when we're seeing certain populations, we're saying, okay, generally we're going to see more perio in this. And I know there's been plenty of studies that support that as well. Because of diet, we are seeing increasing caries in this type of population based on, you know, whatever's available there.
Yep. And so when we do some of the Latin clinics, I don't even think we can even put a finger on it, because these are people who work so hard. They work every day but Sunday, so our clinics are on Sunday. And we can't find a place for them to go sometimes to be treated because nobody's open on a Sunday to actually do the restorative. And there have been some really hard times. Like, I was so concerned about an abscess that a man had. And so the dentist on our team, everyone is like, you have to get in. And he was adamant that he has to go to work.
Gosh, it's heartbreaking.
It is. It is really heartbreaking. And I don't like the fact that Americans have to stand in line to get preventative treatment or, I think that's really hard. Something that I also think about when we think about certain populations and the underserved and just kids getting cavities at a really young age, something that, you know, we've had to start doing, and I'm super proud of it, is when we see a child, so we'll have what's called like child finds for Head Start, and the whole family will come in. It's my favorite thing. It's total chaos, but I love it because the parents are there, and you get to know them, and you get to, you know, be able to explain how important this is or what you could be doing. We will see the older brother who is 4, and we're going to have to refer him out for surgery. And there's the baby brother or baby sister that's with them who is just getting their baby molars. And we'll start talking to the parent, like, I think we should talk about doing some sealants. And we use glass ionomer for the kids. And something I say is, your child's probably really not going to like this, but it's probably going to just be, we're talking 2 minutes at the most. And we could prevent this child from needing surgery. And so that's been really fun. I think that's, with our research numbers, I think that's where we're going to really see the improvement. Is it's pretty hard to think, I've done all this work, and when you're getting kids at about 4 and you're seeing the same amount of caries you saw at the beginning of the project. And then when we're able to get into child finds and WIC clinics and different places, that's where I think we're really going to make the difference. I think that's where our changes are going to come from. And I mean, I just can't even stop smiling thinking about it, because wow, we could really do something. So
how do you know, like, I know this is your life, this is your world, but how do you find a new location to go to? Like, who's going to open your door to you, and how do you figure that out?
So what's really interesting is, at first it was a little hard. We started out with just 2 hygienists, and in our state, you can work in Head Starts and nursing facilities. When we added on dentists to our program, I feel like it's been better for everyone. We were able to, obviously diagnose. We're able to treat our patients better. And again, I'm just so proud of it. We don't go out and solicit people. People hear about us, or a superintendent of a school will be like, you don't have Smiles Across Montana in your school. I can't believe you don't have them. And, we'll get a call, or, especially after the pandemic, I think there was one clinic in particular that I was like, oh man, I can bang this out in a day. I was there for 3 days, I wanted to cry. I was like, oh geez, everyone's signing up. It really is that amazing of a program. I sound to really like myself, but it's really cool. I'd like to see other people doing the same kind of thing. And I think part of how thorough we are and the attention to detail. I grew up in an area of low access to care. I was that person, and so quality is so important to me. That we're really taking care. We're educating. We're doing the best job we could possibly do. And I think a lot of times when we do think of public health, we do think of substandard. And that was just something I would never want to put my name on. And I love each of our patients so much that I just want to make sure that we do the best for them.
I love our students and our new grads, and I don't want them to be offended by my next words. You speak a lot about, high quality of care. Is this a starting point for people that are just coming out of school, or would you prefer that they get a little experience first? Knowing, by the way, as a caveat, that doesn't matter if you've been working 10 years or 2 years. It doesn't mean you're better, right?
So a lot of times we work with some students. I have mentored a few students. I'm really interested in, growing up on the reservation, I'm really interested in getting more Native American dental hygienists. And we've had some amazing people help us with our program and be a part of that. I do think that students should get out there and go and learn from a dentist to have that experience when, especially right out of school. I think you learn so much. That being said, using teledentistry, you're still with a dentist. So I think if you weren't using teledentistry and if you were just out on your own, I think you'd have a lot of questions. Think about when you were first out of school and how many questions you asked the other hygienists.
All the time, yeah.
So I don't really feel like I can answer your question, because I think it depends on the person. And people who are in public health are they're really public health. Like, they're crazy for it, and it's their whole life.
Right.
That's what I'm finding. And I think that it would be a good thing to do, just maybe work for one of our clinics 1 day a week, a couple times a month, something like that. When you're first out of school, could be a great experience.
I love that. I think it gives the appropriate amount of hope to someone that's like, okay, this is really calling to me, and it's not like, it doesn't have to be in the future. Like, it's never going to happen.
No, and I think, yeah, some of these students, I'm just amazed by them. I believe they could do it. I think it's just that confidence thing, right? And just having the experience.
Well, listening to you is really wonderful, because so many people think about a situation where there's an underserved population and it's just too big of a problem to tackle. Where do you start?
Yeah.
And so what do you say to people that are interested in doing this in other parts of the country?
So for me, I would have started with just one kid. Like, we've said that. Like, if you could, I would haul all my stuff in for one kid. And we've done that. I've done that for some of my patients when I was working more with homebound and some of, nursing facilities that we were in, because I've been doing this for about 8 or 9 years. And I would have just went for one. And for people who are wanting to do it in different areas, I think a lot of times we think only about the barriers. We don't make a mission statement. We don't really have a mission. And for me, what has driven me every day is when I'm questioning things, I'm thinking about my mission and how does this align, and joining and having. Joy just hugged me. Sorry.
It's the best day ever.
But adding adding dentists to our program and just not being afraid. I think a lot of us are reluctant. We think they're not going to like mobile. They're not going to, oh my goodness, everyone's here. So this is awesome.
This is the joys of podcasting out in the middle of everywhere.
Yeah, I'm like,
Just
hi.
Hey, buddy.
Your
I'll see
hair
you
looks
later.
beautiful.
Hello.
Beautiful. I don't remember what we were talking about.
What you would say to someone when they...
Oh, if they wanted to do this, I think, thinking about why you want to do it and how you're going to do it instead of who's going to stop you from doing it. I have been so proud of so many dentists that have joined with us and work so well with us. I've never been told no when I asked somebody if they wanted to be a part of our program. We actually have more than enough right now. That's not saying that we wouldn't take more. I think it's just that whole knowing where you want to go, what you want to do, and being able to express that to somebody. I think that's really important, and why you want to do it.
How do you feel, buddy?
I feel good. I love talking about this stuff.
I know. It's very empowering.
I'm just like, but it's just so fun. And I love the idea of having people all over the country doing the same kind of thing.
Yeah.
And something I always think of is we're not trying to put the local dentist out of business. That's not what we want at all. Our consents talk about if you have a regular dentist, that's wonderful. We're going to keep it that way. We can do education. We can talk to your kids about their plaque levels and things like that. We're not trying to take patients, but there's just a lot of people who just don't go, or they'll go once a year. We'll take the second appointment. A lot of what we do might seem cumbersome to some, but it's really helped us have a good relationship with dental offices. We actually don't just take a consent that was signed and be like, okay, they're signed up for ours. They're our patient now. We'll actually call the parent and say, hi, I see that you've signed our consent. And I'll explain to them again what the program is so they understand. And it says that you haven't been to the dentist. Is that like ever? So a lot of times people will be like, oh no, they went like 7 months ago. I'm like, okay, so you do go to the dentist. And it's a lot of work, but I believe that has been one of the things that's kept a real positive rapport in our communities. So
Yeah.
And sponsorship, funding, the big question.
So I'm a grant writer now.
Professional grant writer.
Oh, wow. So I kind of feel like one. There have been so many companies that have just been so good to us. I think a little bit of it is that everywhere I go, that's all I talk about. And so we've had some really great opportunities. From Blue Cross Blue Shield Foundation, Delta Dental Foundation, a lot of instrument companies. There's so many. I probably shouldn't even name them because I'll forget somebody and then I'll feel really bad.
Yeah.
Like so many people will send us things. Even, hygienists that have things that they are not using anymore. And they'll send them in the mail. And I'm like, it's just amazing.
How do you find out about grants?
How do you find out about grants? So I believe it's GuideStar is a great way to start.
Okay.
You obviously are going to need to be a nonprofit. Lancet Van Gilder and I created a CE about this last year because so many people have so many questions of like, what do you do? But we don't speak grant language, but there are a lot of grants out there that you don't necessarily need to. I'm getting to the point now that I'm like, wow, this is way harder than it was when I first started, but we're getting a lot better funding.
Yeah.
Great.
It's amazing.
So you can go to guidestar.com. You also just want to make sure that you are a nonprofit. There are grants. The American Dental Hygiene Association gives grants to hygienists or members, and you don't have to be a 501c3, but most of the time you do. Or another great thing that people don't think about is you can be a sub-awardee on someone else's grant. And that's how we started with Montana State. And they've been so good to us. And our relationship is really, really strong because we all believe in this mission of we're going to improve oral health.
A sub-awardee meaning the award actually went to the university, but
Yep.
then you were contracted
So actually it's called a sub-award, and if somebody knows way more than me, maybe they can write into your podcast and say she doesn't know. But So essentially, they can use their funds to buy us equipment. They can use our funds to help with the referrals, because we talked about how you can hear how laborious that is. It's crazy tracking people down and then calling dental offices and saying, hey, has so-and-so been in? We have made up these codes for, I think it's like 1, 2, 3, 4 for when somebody got their treatment complete. And it's so exciting. And those are like the numbers we're just so excited to talk about. So MSU has been really, really great to us, but the same thing with a Blue Cross Blue Shield grant. They had the grant and we were like subawardees. So It was amazing.
Buddy, I'm so happy for everything that's happening for you. You can see it in your eyes and like your smile, which our audience can't see it, but like you love this so much.
I do. I love it so much. I say the only thing is don't be like me. Take care of your family. Maybe cook for your husband every once in a while. No, it's really contagious, and I love talking about it. I love sharing. I love the way we're doing it, because I really do believe that quality is really important. Just because you're in a situation where you don't have access to care doesn't mean that you don't deserve good care. Absolutely. And I love sharing that part. I love implementing my friends' ideas into our program. Something I'll just do a quick shout out to Carrie Wusinich. I love her, Where the Sugar Bugs book is. We had one of our foundations buy us I don't know how many hundreds of books, and we actually gave them out, but we'd have the nursing students to prepare the kids for their visit. They'd read the book and they'd talk about things, and then they're just so much happier and easier when we'd actually see them.
Oh, that's awesome.
It's awesome.
Yeah, we had that on a tip episode, so if you guys are interested in hearing a little bit more from her, then go back and find our tip episode on that book.
It's a cute book. It's a cute book. And she actually came once and was signing books, and so I actually had to tell her the other day, I sign books for you all the time. I think my thing is keep on brushing. Love, Carrie.
I like it. All right, buddy, any last messages? I know you got to get going to the next thing. Any last messages for our team?
No.
Someone wanted to reach out to you, how can they find you?
So you can go to smilesacrossmontana.com. That's our website, but my personal email is crystalspringrdh@gmail, or you can do smilesacrossmontana@gmail.
Thanks, buddy.
Yeah.
Appreciate you.
Well, and thank you for leading that charge for how dental health is part of your general and medical health and has to be recognized that way.
It's really fun. Thank you, guys.
For all people.
All right. Thanks.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.